we can get started, and I will share your slides, Elizabeth.
Oh, okay. Great. Um, I was just about to attempt that myself, but thank you. And a latte sounds wonderful right now. I wish I had one in hand.
I agree. All right.
Great. So, thank you so much for having us this morning. My name is Elizabeth Wall, and I am the statewide program director for the Indiana Pregnancy Promise program at FSSA, and joined by Carey Michels, who's the project specialist. And so, together, we oversee this program. And we thought this morning we would give a quick overview of our program, share a little bit of our data, and then hopefully have a few minutes to think about how we can continue to collaborate with all of you and the wonderful work that you do across the state. So, um, as you can see, the Pregnancy Promise program, Promise is an acronym for promoting recovery from opioid use, maternal infant support, and engagement. And so, what is this program? So, this is a free, voluntary, statewide program for pregnant Medicaid beneficiaries with current opioid use or a history of opioid use and other substances. What we do is we partner with the four Medicaid health plans, Anthem, CareSource, MDWise, and MHS, to offer enhanced case management services and care coordination for pregnant individuals, beginning in their pregnancy and then extending through 12 months postpartum. And that case management support is not only for the mother, but for the infant as well through the first year of life. So, this program truly is a multi generational approach to service delivery. The goals of our program are obviously to improve outcomes for mothers and infants, to reduce maternal mortality. We know substance use is the number one contributing factor to maternal deaths in our state. And so, the way that our team of Pregnancy Promise case managers supports our population is by helping individuals engage in prenatal care as early as possible, because we know a lot of pregnant mothers with substance use are fearful of even going to see an OB and disclosing substance use. So we want to help individuals enter prenatal care as early as possible. We want to help them connect to treatment for opioid use disorder, and we will meet people wherever they're at on that journey. We have people enroll in our program who are actively using heroin or fentanyl, for example, all the way across the spectrum to we have individuals enrolling in our program who are doing very well on medications for opioid use disorder, but are feeling stressed with a new pregnancy and want the additional support. So we will help connect to whatever treatment is appropriate for that individual on their recovery journey. So sometimes that means we're starting with harm reduction practices, connecting with peer recovery coaches. Some individuals are looking for a different type of intervention, intensive outpatient or residential. So we really do meet them where they're at with those treatment and recovery services. Um, Another really important piece is that we know that our population very commonly has experienced a lifetime of trauma and adversity and have multiple mental health conditions. So we see anxiety as one of the top diagnoses among our participants, followed by depression and then PTSD. But many of our participants have multiple co occurring mental health conditions. And so part of our case management care coordination services are to connect them to their local mental health resources in their communities. Um, And then importantly, we know none of this can be successful if we're not also addressing the health related social needs. So, making sure all of our participants have transportation to and from the care that they're receiving, making sure that they have safe, stable housing. Um, if food insecurity or safety are issues, we address those things as well to really provide comprehensive support for the whole person, the whole family. And then, at the end of the day, we really want to disrupt those generational cycles of substance use. And um, we really want to support the family preservation, mom and baby being together and having that opportunity for attachment and bonding in the first year of life, and support um, parents with this new pregnancy and a new fresh start, that they really can achieve recovery and be well and care for their infant. So importantly, this program does not replace any other existing programs or resources. We're simply an additional support. So families can be enrolled in the Pregnancy Promise program, as well as nurse family partnerships, for example, or healthy families. So they would never have to choose the Pregnancy Promise program instead of something else. We have families that are engaged with the VOA Fresh Start recovery programs, things like that. Um, so, oops. So, thank you. Um, you can go ahead to the next slide. So right now we are fully funded by a 5-year federal grant through CMS, and we're actually one of only 7 states who have the ability to utilize these federal funds to offer this program. And we really credit Secretary Dan Rosiniak, who back in 2020 really had the vision for this type of program and secured the funds, really took the lead on the application to bring this program to Indiana. And it was his statewide vision um, for really serving this population. And so there's just a simple graphic here on the screen where you can see what I just talked about, that we really come alongside pregnant individuals on their journey throughout their pregnancy, um, supporting them with, like we talked about, all the care that they need, so that they have a healthy labor and delivery. And then that support continues through 12 months postpartum for mother and infant. So we can go to the next slide. And I just want to be really clear about the criteria for who can participate. So um, anybody who's pregnant or within 90 days of the end of their pregnancy can enroll in the program, and that enrollment goes through 12 months postpartum. So we try to get individuals while they're pregnant. We understand that that might not always be possible, so people can enroll in our program up to 90 days postpartum and stay in through 12 months. Then, because these are federal funds targeting the opioid epidemic, we do have eligibility criteria that individuals must have current opioid use disorder or a history of opioid use disorder. But to make eligibility as broad as possible, we say and or other substances. So perhaps an individual has had a history of opioid use and now they're primarily using methamphetamines, for example. We will work hard to try to make that individual eligible for our program. We know that polysubstance use is really the reality um, more and more, and so we try to make the definition of opioid use as broad as possible for the purposes of eligibility for our program. Um, we always say to people, if you know of a pregnant individual with substance use disorder and you're not sure whether they'd qualify for our program, go ahead and refer them, err on the side of caution, because if we can't serve them through our program, we will refer them and connect them to other high risk OB case management programs. Um, so the third criteria is that individuals must be eligible for or receiving Medicaid health coverage. The good news is if we receive a referral for an individual who recently found out they're pregnant, for example, and is struggling with substance use, but they don't have Medicaid, my colleague Carey, who is on the call with us today, is a licensed insurance navigator and can walk them through that pregnancy Medicaid application as a first step. Okay, next slide. I already mentioned our partners. So we have a team of Pregnancy Promise nurse and social work case managers across the state who are employed with one of our 4 partners. Like I said, either Anthem, Medicaid, CareSource, MDWise, or MHS. However, we're all one unified Pregnancy Promise team. So if an individual is with MHS, their pregnancy promise experience is going to look very similar to an individual who might be with Anthem Medicaid. We we meet regularly as a team. We work together to be very consistent in our supports and services and to share resources. And just our MCEs have been very collaborative in this process. All right, so we can go to the next slide. One thing I haven't mentioned, so we did go live with this program in July of 2021. So we are in our 3rd year of enrollment at this time. And like I said, it's a 5-year federal grant. So we are also at a point where we are thinking about sustainability, and we are working to secure additional funds to be able to continue to offer this program beyond this particular federal grant funding period. I didn't want to forget to mention that. Um, so referral information. So this is really key. Anybody can make a referral to the Pregnancy Promise program. Individuals can self-refer, professionals can make referrals, even friends, family members, loved ones. We have a secure online referral platform on our website. It takes 3 to 5 minutes tops to make a referral. You simply click on the link. You click on our website, there's a big green button that says enroll or refer. You click on that, and then you'll get a drop down menu to say, I'm either referring myself, or I'm a professional making a referral, or I'm a loved one. So you would obviously click I'm a professional. It's going to basically ask for your information, your agency's contact information, and then we essentially just need the name and a way to contact the individual for whom you're referring. Now, we know that oftentimes individuals might not be aware that someone's made a referral on their behalf. Obviously, best practice would be to let people know that you're making that referral on their behalf. But when we initially reach out, we're very discreet and we're obviously protecting all of the confidential and private information about the individual. So we simply say, my name's Elizabeth or Carey, calling from FSSA, Indiana Medicaid, wanting to talk to you about programs and resources we have available. We obviously don't leave any messages about we understand you're pregnant and have substance use. We're very discreet. Um, so, so in addition to our referral platform through our website, we also have an email inbox where somebody could reach us to make a referral. And then we have local and toll-free phone numbers. And then those are also staffed by 211 after hours. So we've got good coverage on those phone lines. Okay, next slide. And so really we get asked, why would someone want to be involved in your program? And we say it's about a couple of things: connection, coordination, and prevention. So we are here to our case managers are wonderful advocates for this population, and we are here to help make all of your work more successful, right? We want to ensure that individuals who are managing pregnancy and substance use are, like I said, getting to those prenatal visits, getting to their important mental health services, getting to their daily um, opioid treatment programs, getting to WIC, any other resources that they might need. So we're all about really working together to help individuals be successful in managing what can be a very challenging time. So we do once we enroll individuals, we do comprehensive screenings and assessments, not only for substance use, but alcohol, tobacco, depression, anxiety, their parenting goals. And we write these very comprehensive care plans that we update frequently. And so we want to be able to get releases signed and share those pregnancy promise care plans with all of you, with the OB provider, if the family has DCS involvement because they have older children, for example, we want to be able to collaborate with DCS. Um, and we've had great success there in terms of um, babies being discharged home after labor and delivery with mother because we've gotten ahead of all these safety concerns in pregnancy. We're not seeing infants being removed from our participants. And in fact, we're seeing a lot of several instances of reunification. As we continue to support families after labor and delivery and throughout the postpartum period and sustaining recovery, we're seeing a lot of our participants be reunified with older children, which has been a really positive outcome of this program as well. Um, so that's what we mean by the prevention. And the other thing that we want to prevent is pregnant individuals from experiencing incarceration, right? So if we can get ahead of all of this as early as possible in pregnancy, we know that the family has a good chance for a strong future. So next slide, and Carrie, go ahead.
Hi. Yeah. So one thing that we really wanted to work on when implementing the program, we really were hearing that a lot of individuals were having a hard time with once they had the baby or if they had older children, having a safe place to take their child while they attend all of these appointments. So we were able to partner with the Office of Early Childhood and Out of School Learning to provide access to childcare for our enrollees. So typically, to have access to the CCDF funding, there are certain work and education requirements that an individual must meet. So, for the purposes of this program, we were able to waive the work and education requirements and replace those with an individual's treatment and postpartum follow up care needs. So, individuals in our program are able to get access to this funding, and then they're able to get care for the child they're enrolled in the program for and any other child in the home up to the age 13. So they have safe, regulated childcare while they're attending all of their appointments. We find a lot of times that individuals that we work with, they don't necessarily have family members, friends who are able to safely care for their children. So having access to the childcare is really an important benefit for them. Next slide. And then also, I wanted to talk about the current enrollment data. So, as of today, we have 765 individuals that we've been able to work with their families to date. We are always outreaching and working to get a hold of individuals. We have a continuous outreach process, so we will continually outreach individuals who are potentially eligible until they either answer the phone and say, no, thank you, I'm not interested, or they've reached 90 days postpartum and they are no longer eligible to enroll in the program. And we have found that it takes 8, 9, 10 attempts until we're able to get a hold of them sometimes, but then we are able to work with them and get them enrolled. So there's no um, 3 tries and you're no longer eligible. We do continuously outreach them until we're able to get a hold of them. We have 543 infants that have been born, and there are many of our participants who are still currently pregnant. We've seen enrollment in 86 counties, but as Elizabeth mentioned, we are available in all 92 counties, and we're still working to get enrollment in Benton, Carroll, Whitley, Tipton, Pike, and Perry counties. So if anybody has any ideas of people we could collaborate with and work with to be able to reach those counties, we are always working to reach enrollment and really be able to provide any gaps in services that individuals might be receiving. And then we do often get referrals for people who don't necessarily meet the criteria of current or past opioid use, but we have been able to link over 400 pregnant individuals to other high risk OB case management programs. So, like Elizabeth said, even if they aren't able to participate
We might be losing Carrie's audio.
You're breaking up a little bit, Carey.
now.
Um, s- can you hear me okay, Leanne?
I can hear you.
Program,
Okay.
we do make sure to hear.
So, right, I think Carrie was essentially saying we've helped an additional 400 pregnant individuals who are not eligible for our program connect with case management resources and supports. So we can go to the next slide. And then just a few things that we wanted you to know that we're responsible for measuring and reporting to our CMS funders. Um, this program really was designed to determine, how well can we help address the health related social needs of our participants in terms of helping people secure housing, employment, transportation, those types of things. So we have a lot of data around that. Um, how well are we helping individuals initiate and engage in OUD treatment, including continuity of medications for opioid use disorder during pregnancy and throughout the postpartum period? We know that there's still a lot of stigma that exists around buprenorphine and methadone, but we also know that that is the standard of care for treating opioid use disorder in pregnant individuals. So we have a lot of data on that. And then importantly, we want to help individuals get to that postpartum follow up care, educate around family planning, healthy birth spacing, and make sure individuals have access to long acting reversible contraceptives. And then finally, and additionally, we obviously are tracking data around sustained recovery. Um, and then for the infants, we're looking at um, infants born at healthy birth weights, instances of infants born with neonatal abstinence syndrome, and tracking the severity of that. How many of our infants are needing to be treated with that pharmacological care? Um, are we seeing a reduction in that need? Are we seeing shorter NICU stays if a NICU stay is needed at all? So there's many, many infant income outcomes that we're tracking as well as the parents' outcomes. So we can go to the next slide. And this is a snapshot of our annual report. I believe you will get a copy of this, but it's also on our website that really highlights some of those outcomes that we just talked about. And then the last slide. So, how can we partner together? We would ask that you share and disseminate our program information. We have flyers available in English, Spanish, Burmese. Um, Leanne, I can send you our one-page flyers too if you don't have those already. We want them anywhere and everywhere people are going to find them: clinics, offices, waiting rooms, local libraries, you name it. So we'll be sure to send those one-page flyers. If you know of individuals that are meet our criteria, please make referrals through our website. Um, we also are looking for representation from our community mental health centers to be part of our statewide steering committee, which meets quarterly, that really helps advise our program leadership. So if you have an interest in being part of that steering committee, maybe connect with me or Leanne, and we would really love representation from our community mental health centers. And then again, just want to thank you for helping us to continue to educate and destigmatize around treatment for opioid use disorders. So I know that that was a lot of information. Hopefully, we've got a few minutes if there are any questions or comments or thoughts.
Thank you so much, Carrie and Elizabeth. I appreciate that. A lot of great information and just amazing to see how much you've accomplished in, you know, the 2 short years that you've been doing this program. So that's fantastic. Do we have any questions? And I will send out the slides also that Elizabeth had shared. That way you guys have the access to their program. And also, if you could send those counties, Elizabeth, to me that you don't have representation in,
Yes. Yep.
that way I can have that to share also with our membership. And for those CMHCs that heard their county called, I'm going to be calling on you too. So
And
go ahead.
yeah, and I'm just curious too. One of the things that we're really trying to get better at, and as I'm sure you all know, can be difficult is so we have, like I said, that comprehensive pregnancy promise care plan. And we try to identify all of the providers that our participants are working with. So they're mental health providers, they're OB providers, they're substance use treatment providers. And we ask our participants to sign a release of information so we can share those care plans and collaborate with all of you. It's challenging sometimes, but if any of you have any, thoughts or ideas about how we can, improve that collaboration, how we can um, encourage our participants to feel comfortable signing that release. If there's anything that all of you want to impart any wisdom on for us to say, Here's what we found makes that process go better," we would love that because we really want you to know what it is that we're supporting the member around, and we really want to be on the same page with what it is you're doing to support the member too. So,
Thank you. Thank you so much, Elizabeth. I did have a question. So have you guys, do you go into the jails at all for individuals who might be pregnant and incarcerated for a short period of time?
so we have had individuals who found out about our program, and we've met with the sheriff's association, and yes, and so we've been able to start that process of enrollment. And then once they return to the community, we can really, write that care plan and kind of get off and running. One of our actual very first referrals was a handwritten letter from a pregnant individual who was incarcerated, who was letting us know the date that they were going to be released and how much they wanted to be part of our program. And we've been able to talk with the jails about who we are and what we do. And so there have been times when our case managers have been able to contact pregnant individuals who are currently incarcerated to have just some phone contact about, here's what we can do upon your release.
That's great. Very, very good information to have. And thank you again to both of you for all this information. Another great program that our state has to offer.
Yeah.
Um, that's wonderful. And thank you all for joining the first ever Lattes with Leanne. Our Starbucks card winner is Miss Diana Huddleston. And so I will send that out to you. And thank you all so much. And cheers to Lattes with Leanne. Have a great day, everybody.